Donning personal protective equipment sequence for high possibility confirmed Ebola virus disease with a Tyvek coverall. The dressing of PPE sequence should be supervised by another trained member of the team known as the buddy and documentation completed. Hand hygiene. Either alcohol-based hand rub or soap and running water can be used for hand hygiene. Always perform hand hygiene with soap and running water when hands are visibly soiled. Don scrub suit and changing area. Ensure pockets of scrubs are empty. Ensure closed, puncture and fluid resistant footwear are worn. Secure hair back of face and neck. Begin by sitting on a chair. Tuck trouser leg of scrub suit into socks. Don boots or knee-high boots. Secure all ties with a simple bow. Perform hand hygiene. Carefully put feet into leg of coverall suit, one by one. Boots under coverall suit legs. Stand up, pull coverall suit to waist. Don respirator protection FFP3. Position one strap at neckline and second strap at crown. Fit check mask, breathing deeply in and out to check for leakage. Put on visor with or without goggles. Adjust to fit. A visor can help reduce exposure to the eyes and provide protection to other facial areas. Goggles help protect a wearer's eyes from splashes, sprays or droplets and can be worn in addition to visor. Perform hand hygiene. Put on first pair of extended cuff gloves, undercuff. Gloves that fit snugly around the wrist are essential for use with a suit. Place arms into sleeves before zipping up suit. Pull hood overhead, zip coverall to top and push zip down to lock. Ensure visor and hood overlap. Don apron over coverall. Put on second pair of extended cuff gloves over cuff. Gloves extend over suit cuffs. At this stage, final check of PPE should be completed by the body and any breaches corrected. Complete log room sheet and PPE sequence sheet. Inform colleague while wearing PPE. Avoid touching or adjusting PPE. Remove over-cuff gloves if they become contaminated. Apply further set of sterile gloves in room. Doffing personal protective equipment sequence for high possibility or confirmed Ebola virus disease with Tyvek coverall. The removal of PPE sequence should be supervised by another trained member of the team known as the body and documentation completed. Before exiting isolation room, remove over-cuff gloves and apron. Remove theatre overshoes while double gloved, if donned over boots due to copious amounts of blood, vomit, faeces or other body fluids present in the environment. Remember, outside of gloves and apron are contaminated. Over-cuff gloves. Grasp outside of over-cuff glove near cuff with opposite gloved thumb and forefinger. Peel off, turning it inside out. Hold removed glove in still double gloved hand. Slide fingers of single gloved hand between interior of double glove and suit. Peel off, turning it inside out. Discard glove bundle. Apron. Remove apron by breaking the ties at neck. The bib then falls forward. Break ties at sides and fold or roll into a bundle, touching the inside of the apron and discard. Exit isolation room to doffing area. Body will supervise and give direction on sequence. Body does not touch colleague and prepares to record documentation sheets. Coverall suit front, sleeves and the outside of undercuff gloves are contaminated. Remove coverall suit, roll the hood back, inside folding out, taking care not to let the outside of the hood touch the head. Unzip the coverall suit, grasp the outside of the suit at shoulder area, begin rolling it outwards and down over your shoulders. Place both hands behind back and pull down each arm, touching the outside only. As you pull down, peel off your gloves at the same time. only touching the inside of the gloves and suit with your bare hands. The suit may then be rolled down into an inside-out bundle. Ensure contaminated side is not touched or comes in contact with clothing. Perform hand hygiene and don a new pair of gloves. Reach inside leg covering and open laces of boots. Remove gloves. Grasp outside of glove near cuff with opposite gloved thumb and forefinger. Peel off, turning it inside out. Hold removed glove in still gloved hand. Slide fingers of exposed hand between wrist and interior of glove. Peel off, turning it inside out. Discard glove bundle. Perform hand hygiene and don a new pair of gloves. Remember, outside of boots are contaminated. Put gloved hand inside leg covering, fold covering down inside out to ankle and remove boot and covering over foot. Perform hand hygiene and don new pair of gloves. Repeat the sequence for the second boot. Perform hand hygiene and don new pair of gloves. Remember, outside of visor or your goggles are contaminated. Remove visor or goggles. Do not touch the front of the goggles or visor. Hold by headband of visor or arms of goggles. Lift away and outward from face. Remove gloves. Grasp outside of glove near cuff with opposite gloved thumb and forefinger. Peel off, turning it inside out. Hold removed glove in still gloved hand. Slide fingers of exposed hand between wrist and interior of glove. Peel off, turning it inside out. Discard glove bundle. Perform hand hygiene. Remember, outside of FFP3 mask is contaminated. Do not touch face or front of mask. Remove FFP3 mask. Grasp bottom ties or elastics of the FFP3 mask and remove overhead first without touching the front. Then grasp the ties or elastics at the top and remove overhead without touching the front, holding by straps. Discard. Perform hand hygiene. Buddy now completes the documentation, the log room sheet and the PPE sequence sheet. She notes any breaches and reports immediately to ward manager. Perform hand hygiene between steps if hands become contaminated and immediately after removing all PPE.